Hello and welcome back to Focus Atlanta. Thanks so much for continuing to watch. In this segment, I want to talk a little bit about severe asthma. I'm here with Dr. Siri. Thank you so much for making time for us here in Atlanta.
Thank you, Keisha. I really appreciate being here. It's very timely to talk about asthma with all these weather changes.
Absolutely. Can we talk a little bit about severe asthma, what those symptoms look like?
Yes, so severe asthma, we categorize that as mild, moderate, and severe. It's about 2 million people in the United States who are suffering from the severe category of asthma. It impacts their daily life. It can lead them to emergency room visits, even one a year, hospitalizations, even one a year or one recently. Patients are suffering from coughing, wheezing. They can't breathe, so that's called dyspnea or shortness of breath. They're struggling doing usual activities that we all do, getting dressed, walking to our car, grocery shopping, picking up our kids, walking our dog. And patients now are also with severe asthma having unpredictability, not knowing when things might get attacks, when they have to use their medications, and they're finding they're using their medications a lot. And some of these patients, of course, are waking up at night, which I think is a frightening feeling when you wake up at night and you can't breathe.
Can we discuss some of the causes of severe asthma?
Yes. So I think that people think maybe it's an allergy, maybe it's something that they had a virus and now they have asthma. Some people think that it might be the fact that they live next to a road and there's a lot of pollutants. Whatever the cause is that they thought about, in the end, it's actually the inflammation that is the issue, and it's inflammation that remains unchecked. It's like a forest fire going wild and you can't control it now. And so with that type of inflammation, we call it as doctors type 2 inflammation. It's important for us to recognize what type of inflammation we have so that we can target medication specifically to that inflammation. And so it's not about having a weakened immune system, but an overactive, inflamed immune system in the lung.
For patients who do suffer, what type of treatment options are there?
I think that you and I probably know a lot of patients who are on traditional treatments for asthma, which are inhalers. These are medications that have been developed to add medications into the lung directly, the respiratory tract directly, in order to suppress that inflammation. Sometimes there have been some pills that have been developed, of course. And then we do have our rescue nebulizers or inhalers that we use in order to treat those attacks, to relax the muscles when we're having attacks and our muscles are contracting in our lungs. But the newest advent of medications is to target exactly that type 2 inflammation that causes the majority of asthma, including severe asthma. These drugs are called biologics. They're usually by injections, and again, they're precise targeted treatments for inflammation. The unfortunate thing is that in some communities, many communities, different regions of the United States, people aren't aware that biologics are available, that they are really precise treatments now instead of suppressing the immune system all over the place, and that only 20% of patients who are eligible to take these biologics are actually on them.
In terms of having that discussion with our care providers, what do you ask for? What do you say when you're addressing the issue of not being able to get something new that might be a treatment for you?
Even as an expert, all the time I have patients coming up to me saying, hey, is there anything new, doc? And, it's my responsibility then to research and say, you know what? Maybe there is something new. Let me look that up for you. So I think the conversation starts with oftentimes the patient these days, researching them themselves, taking action, believing and understanding that they could live a better life, that maybe it's not about age, maybe it's not about their lack of activity or exercise, maybe it's not about what they're eating. Maybe these things occurred because their asthma is inflamed and uncontrolled. So first speaking to their doctor about that. I'm here also on behalf of GSK to talk about one of the newer treatments that's available, which is called Extensor. It's newly FDA approved. It's the first and only ultra long acting biological treatment as an add-on for treatment for severe asthma. And what's novel about it is that we think of biological injections as, once a month, but this one is actually 2 doses a year. As with any therapy, there may be some potential side effects, some of which can be serious, like allergic reactions, including anaphylaxis. Though not common, these can occur, certain infections. So I would first encourage your audience, Keisha, to speak to their doctors, to recognize that maybe even though they think their asthma is not severe, maybe they are in that category of severe asthma, and to ask them what is new, what's appropriate for them.
Dr. Suri, thank you so much. Can we close out with any last minute thoughts? Anything that you would tell a patient who's been suffering?
Yeah, certainly. I think that a lot of patients, again, are out there, and this is one of the hugest issues, especially in the South. We have a preponderance of asthma patients and really undertreated asthma patients. And in order to access communities that need better, newer treatments, sometimes we've got to ask for it.
Thank you so much for your time. It was good to meet you.
Good to meet you. Thank you. Thank you, Keisha.
All right, guys, there is hope. There are options. There are medications. Sometimes I know that we feel like it's all a little daunting when we've been suffering for so long, but please take the opportunity to go to the website, learn a little bit more about more options. Thank you guys for tuning in to this week's episode of Focus Atlanta. I hope to see you next week here on CBS Atlanta.